Powerful currents are reshaping our world. Climate change, aging populations, inequalities, conflict, and technological advances are transforming the way we live and the health of our societies. While these megatrends bring challenges, they also open doors for innovation and bold, impactful change. To navigate these currents, the second European programme of work will be our Health Compass, guiding us toward a healthier, fairer, and more secure future for all. Your voice, our future.
Good morning, dear colleagues. A very warm welcome to the final session in our series of the second European Programme of Work, Public Hearings. My name is Cristiana Salvi, and I will be co-moderating today's hearing. Health security is the theme of today, one that has risen significantly in both public perception and on government agendas. 5 years ago, emergencies felt distant from our region. However, from COVID-19 to mpox, natural hazards and conflicts, the past 5 years have reshaped the way we work. Just last week, we marked 3 years since the war in Ukraine, the region's largest ongoing conflict. To dive deeper into this, to learn about the megatrends, let's listen to a conversation between Dr. Hans Klug, the WHO Regional Director for Europe, and Dr. Ihor Perejines, the Regional Emergency Director, who are joining me in the studio today.
Thank you, Cristiana. Great to be here as a new Regional Emergency Director. I'm not new to the health emergency or public health, and I feel that today health security is a critical concept for our region, the region that faces many challenges and emergencies. Thank you very much for coming here today, and I'm happy that I'm joined by the Dr. Hans Kluge. Welcome, Hans.
Thank you.
And you have a huge experience as a professional, being a doctor, being a policymaker, leader of the agency. In your experience, your personal and professional experience, why the health security is so important nowadays?
For me, it's also personally, as you say, Ihor. And first and foremost, congratulations again with your very important appointment. I think the region is in good hands. When I started to work with Médecins Sans Frontières, Doctors Without Borders, in Somalia, in Liberia, I saw what it meant. The violence, women, girls, men too, not being safe. Later on in my career, in other continents, we saw the same consequences, but it can be from all different kind of threats. And then people often ask me, what was the worst? What I got to know, Ihor, is that you cannot compare human suffering. Every person who suffers is one too much. So it touches the core of my mission in life, of the mission of EPW, to leave no one behind. That's what health security is about.
Thank you, Hans. Yes, this great explanation and even gives us a definition of the health security. But very often we hear health security from different angles now. Why do you think this is important for WHO Euro also to take health security as your top agenda?
So what's health security? Of course, there are many definitions. We also discussed this. I see it as a kind of a safety net, a health safety net for all people, particularly the most vulnerable, for what you taught me, kind of all hazards approach. So can be the earthquake, can be a bomb. Unfortunately, as Cristiana mentioned, the war is still sadly ongoing in Ukraine and in the other parts of the region, Israel, Gaza. So we live in a kind of a perma-crisis. Remember, when I became regional director 5 years ago, we had the COVID-19. Yeah. Now 5 years later, we have the US withdrawing from WHO. Is also a big crisis because who is suffering? For me, it's not so much about finance of WHO, it's about the AIDS patients, the TB patients in war zones and other zones without any medicines. So in this perma-crisis, we have to stand together really to make our society safe and secure. And I'm very grateful to Poland, to the Prime Minister there, who made security top of the agenda of the EU presidency and explicitly put health over there. It was very important, because without health security, there is no economy. There is no, let's say, climate change, right, addressing, because whatever we do, it has an impact as well. And ultimately, it's important to calm down the people, because too many people are anxious, right? This is something yesterday we heard it from Professor Lorenzo in Portugal. 1 out of 4 women are prone for depression, the youth as well. So we need to work together to make this a top priority in EPW2.
So health security basically touches all the elements of our everyday life.
Yes.
It depends on the actions from the governments and the societies. So why still the health security as the concept or emergency preparedness is not picking up the attention from the broader perspective of the governments or the societies?
It's a very good question, Ihor. Actually, it's a $1 billion question. I'm not sure I have the answer here. But I think we called it the cycle of panic and neglect. And we saw it with the COVID-19. Actually, still millions of people suffer from long COVID, for example. But already health is falling down from the political agendas. Right? So this is a big issue. There is a panic and then there is neglect. Being a born optimist, I try to take it positive. Sometimes it's not bad, because there is so much misery, so many cruel things you see on television, on media, that maybe the fact that human memory is short sometimes can help us. Maybe it's also a survival mechanism. But of course, the basics have to be there. Concretely, for example, in Ukraine, the capacity to detect outbreaks quickly have to be there, is important for all other countries. And the same for the US, right? If in the US, measles, polio, outbreaks going forth, and this is not being shared, we're all in trouble.
So it touches every aspect of the life. It requires attention. We learn the lessons. From your perspective, what additional role WHO can play as the agency to coordinate all these efforts, and where our essential part in these efforts are?
As you know, yesterday evening I was at the German embassy with the CIANA CEO network, and the German ambassador, Professor Pascal Hector, gave a great speech, like a almost global health ambassador, and he was reminding everyone it is only WHO which has the international mandate to coordinate health matters, health security, and no any other agency can do it, has legitimacy of 194 member states. And we have done a lot of work. You have done a lot of work, and Christian and the people, with the preparedness 2.0 framework, which the member states appointed, exactly, with the pan-European network of disease control. I think you have to fall back on regional resilience and count on our partners. It's a great honor for me that Ms. Sandra Galina is part here from DG Santé. Thank you so much, Sandra, but also the organization of Turkic states, yeah, Minister of Moldova. So we see that there is a coalition of the willing, and we have to move forward with determination, but always reimagine WHO itself. We have to move back to the future, Ihor, and that's what we are doing today.
Thank you, Hans. So it's excellent that we, under your leadership, all understand the WHO, the health security concept, and it's clear that we, with everything we do, are perfectly positioned as a WHO, especially Euro region, to coordinate and guide the countries in these difficult times to ensure health as the security. Thank you, Hans.
My pleasure.
Christiana, back to you.
Thank you, Ihor. Thank you, Hans, for highlighting the critical role of WHO in health security, which is definitely a complex and multifaceted area, undoubtedly at the core of our mandate, and where complacency is simply not an option. The next segment features keynote speeches from 3 distinguished speakers representing key geopolitical areas in our vast region. We will hear how health security is not only a priority for WHO, but for all our critical partners. First, joining us, we have Sandra Galina, as Dr. Kluge said, who is the Director General for Health and Food Safety at the European Commission. Good morning, Sandra Galina. The floor is yours.
Good morning. I hope you can see me. I don't see myself anymore. I don't know why, but I hope it's all clear. Anyhow, can you hear me? Can you see me?
Yes, we can hear you, Dr. Galina.
See me? Yeah? I don't see myself. Anyhow, I am really honored to be here, and I would like to thank Hans and Ihor for the nice words that they had also for us. Today, I think the topic could not be more timely. We are facing a convergence of pandemic risks, infectious diseases, and natural and human-made hazards. As was mentioned earlier, from climate change to political instability, we have also antimicrobial resistance and misinformation. So coordination is vital. Health security is not just for health ministers. This is a very important concept that was somehow referred to by Hans and Ihor. It is for every sector, every level of government, every citizen. The EU has integrated health security into our geopolitical strategies to ensure, I would say, the resilience of our, of our societies. Later this month, the EU will publish 2 strategies on the preparedness of the Union and 1 on the internal security, which I think will be very important for all of us. They will look at civil and military preparedness, including towards health threats. Finally, a word on One Health. With the avian flu spread into mammals, hopefully not to humans so fast, we need to stay vigilant and with a strong One Health approach. But I would like to say that preparedness is not just about being ready to react, it's also about acting before the crisis escalates. This means we need to anticipate, we need to invest in intelligence, data, early warning. We need to have strategic foresight. This is why the EU is very keen on designating EU reference laboratories as key public areas, of interest. I think that foresight is not enough, though. We also need efficient and well-trained teams. We need robust systems. We need secure supply chains. But above all, we need global partnerships, especially with WHO. This is why I repeat, I'm honored, but also very pleased to be here today. Since the COVID, we have built the European Health Union. We tried to be much better prepared to respond to crises. The regulation on serious cross-border health threats within Europe tries to ensure a robust response. The member states must report on their preparedness and need to feed the assessments of the ECDC. All of this should be in, I would say, strengthening our collective resilience. In January this year, we did an assessment together with the WHO of this reinforced emergency preparedness plans that we have. Later this year, we will also launch the EU Prevention and Preparedness Response Plan. Now, this plan will complement the national plans. It's very important that we understand the nature of things here and will be aligned with the WHO international health regulations. It is going to be a practical document, I want to say, for all the member states to be, I would say, really stakeholders in security. I would like to say that there is also preparedness for chemical, biological, radiological, and nuclear threats. That is a priority for us. Perhaps the amount is not very rich, but we have a 6 million contribution agreement to, I would say, I think there is a problem with my video. It worked perfectly. It is on. I want to make it clear. It is on. I don't know why it is not passing, which is a bit of a disaster for you. And I'm very sorry for this, but I have no possibility to do otherwise than have my video on. So going back to the 6 million contribution to the WHO, we try to support the Ukraine and its neighbors for this. I would say that the Health Security Committee has set up a technical working group on civil and military cooperation. I'm very proud of that subgroup because it's going to do good work to make Europe a safer and more secure place. It's important to work together. It's important to really understand that everybody has a role here. I look forward to continuing the excellent cooperation with WHO Europe, and I thank both, I would say, Hans and Ihor for this space. I'm sorry about the video. It's not my fault. I have the video on constantly, and I don't know why this is not working. There must be a problem because earlier it was working perfectly. Thank you to you all. I hope the audio at least was audible. Thank you.
Thank you, Ms. Sandra Gallina. Unfortunately, we could not see you, but your words came out very loud and clear. Your insightful words, and we want to thank you. Thanks for all the European Commission is doing to prioritize health security. We are indeed working closely to align across the European Union and beyond, ensuring a more resilient and cooperative approach to safeguarding public health. Next, the Ambassador Kubanishbek Kasimovic Umaraliev, Secretary General of the Organization of Turkish States, who will highlight the importance of sub-regional cooperation in tackling cross-border health threats.
Dear colleagues and friends, it is a privilege to speak at this final hearing of the second European Programme of Work. We give utmost importance to partnership with WHO and maintain close cooperation to achieve our common goals. We will hold the 5th meeting of Ministers of Health OTS on 8th April in Astana, with participation and the valuable contributions of WHO to address critical health issues and advance our shared priorities. Although we are meeting virtually today, the urgency of health threats doesn't recognize border or distance. We witnessed how dangerous cross-border health threats can be during the COVID-19 pandemic, disrupting lives, economies, and the societies, and testing the limits of our health system. During this crisis, the member states and observers of Organization of Turkic States showed strong solidarity, sharing medical aid, resources, and the vaccines, even extending support to Africa. Today, we face serious health challenges, including new infection diseases, the health effects of climate change, and the growing problem of drug-resistant infections. By working together, we can monitor emerging threats more effectively, respond to crises more swiftly, and recover more quickly in the aftermath. Health security is shared responsibility. At the 11th Summit of OTS in Bishkek, we took significant steps to strengthen regional cooperation by signing the agreement of the establishment of civil protection mechanism and adopting the Turkic Green Vision. These initiatives provide a framework for joint disaster response, capacity building, and the knowledge sharing, ensuring our region is better prepared for emergencies. By addressing climate change and its impact, we also tackle the root causes of health threats and the food insecurity. In conclusion, I would like to remind that the challenges we are facing will continue to evolve, and so must we. We would like to ensure no one is left behind. By building strong partnership and focusing on shared health security, we can ensure that we are better prepared and more capable of protecting the health and the well-being of our people. Thank you for your attention.
That was an important message from the Secretary General. Working at the sub-regional level, we can identify common challenges and share solutions, and leverage each other's experience and support. For our final keynote intervention, we turn to a country that has faced a double blow. First, with the impact of COVID-19, and then with a significant influx of refugees. Yet the country health system not only withstood these challenges, but turned them into an opportunity for growth. It is my pleasure to welcome Madam Minister of Health for the Republic of Moldova, Dr. Alla Nemarenko. Dr. Nemarenko, thank you for joining us.
Dear colleagues, dear partners, good morning. In recent years, Moldova has faced an unprecedented triple challenge, as you mentioned. First, the COVID-19 pandemic, the energy crisis, and then a large influx of Ukrainian refugees. This crisis put immense pressure on our health system, testing its limits. However, rather than breaking under the strain, we seized the opportunity to accelerate reforms strengthen resilience, and reinforce our commitment to universal health coverage. A key lesson we have learned is that health security is not just about emergency response. It's a long-term investment in system-wide preparedness and sustainability. In the case of Moldova, we demonstrate that strengthening emergency medical services is one of the key pillars of resilience. With this in mind, Moldova prioritized strengthening its emergency medical services, ensuring that frontline responders had the capacity, resources, and training to act swiftly in times of crisis. By investing in the infrastructure, we renovated and fully equipped 2 emergency care units in the largest national hospitals, also 14 intensive care units, many operation rooms, medical devices were put. We organized rapid response mechanism, also equipped with ambulances, more than 200, the pre-hospital ambulance services. We paid attention to manage health emergencies, but also we enhanced the overall efficiency and equity of our health system. Our experience aligns with WHO visions for preparedness 2.0, a proactive, integrated approach that bridges emergency response with long-term health system strengthening. We must move beyond reacting to crisis and instead build a health architecture that is resilient by design. This requires strong governance, sustainable financing, and coordinated action across sectors. Working on IHR core capacities while implementing national health security plans is a straightforward answer to how to build health security and implement EPW commitment to protect people from health emergencies. Most important, crises must serve as catalysts for political will. The COVID-19 pandemic and recent humanitarian challenges have demonstrated that when health is at the center of national policy, it can drive broader investments in economic and social stability. Moldova's progress proves that even in the face of adversity, we can transform health system to be more responsive, resilient, and people-centered. The EPW2 hearing as a pivotal moment to reaffirm that health security is an investment, not a cost. The rising frequency of health emergencies in our region demands a shift from short-term crisis management to long-term system-wide preparedness. Moldova supports WHO, Europe's call for a coordinated, multi-sectoral approach that integrates health security into national framework, ensuring that even in politically and economically challenging times, health remains a central pillar of development. As we contribute to shaping the European health security vision 2025-2030, Moldova stands really to share lessons learned and work collectively toward a safer, more resilient future. Let's act now, because the next crisis will not wait. Thank you very much.
A huge thanks to Madam Minister Nemirenko. Your words highlight 2 key points. 1, a country must be prepared to face multiple emergencies simultaneously. And 2, crises provide opportunities to build back better. You said health security is an investment and not a cost. This is exactly what we are striving to achieve collectively through the second European program of work. There is no other areas, indeed, where working together is so critical as health security. Today, we are hearing from the voices of public health and other sector leaders. It is the concert of all these voices that can make us safer. Before that, let's frame health security through the images and words of this video.
The health security of our region is being tested. Infectious diseases, natural hazards, climate change, conflict, and the spread of mis- and disinformation threaten the well-being of millions. Poliovirus, Mpox, avian flu, TB, HIV and hepatitis remind us that infectious diseases do not respect borders. As the threat of pandemics grows, an alarming rise of drug resistance is undermining medical advancements we've fought so hard to achieve. Daphne Decker is an AMR survivor.
Antibiotics are precious, but when they stop working, we don't have an alternative yet. So please, let's handle them with care.
This is the reality of our interconnected world. To protect health, we need urgent, coordinated action.
And we need to be able to respond to prevent infectious disease risks in their tracks so that the next pathogen that comes along, we're already linked and ready to go.
But amidst these challenges, there's a silver lining. WHO member states reinforced their commitment to health security at the 74th Regional Committee. Health security is about protecting people from health threats. Health security hinges on prevention, preparedness and response. WHO convenes stakeholders to ensure rapid exchange of critical information to detect and mitigate health hazards. WHO provides evidence-based recommendations to bolster member states' surveillance and laboratory capacities. This work may not make the news, but it's vital. Someone has to do it, and that someone is WHO. Health security is about building adaptive, sustainable, and resilient health systems that can weather any storm. National action plans ensure we address vulnerabilities before crises hit. In a world as unpredictable as ours, one thing must remain certain: the availability of uninterrupted health services. Emergency medical teams are critical to this effort. Over 75,000 professionals in the region are trained and ready to provide quality care during emergencies.
The EMTs are this beautiful mix of a preparedness or response mechanism, because you strengthen your national capacity to prepare and respond, but you're also doing a global good, or you're contributing, making a significant contribution to international humanitarian efforts.
Communities are at the core of collective health security.
We know from decades of outbreak response that unless your communities are on side, then you'll never do as good a job and bring the outbreak to a close as quickly as you could.
Communities are central to containing diseases, increasing vaccine uptake and disseminating public health advice. To ensure an effective response, we must listen to and learn from communities.
No one person can do this alone, no one group, no one country. It really has to be a collaborative effort. There's no time to waste.
There's no time to waste. That was a great introduction to our next presenters. I'm joined now by two of our directors who will provide key insights to help frame the discussion ahead and guide our work in the breakout sessions. Rob Butler, he is WHO's Europe Director for Infectious Diseases, Climate Change and Environment. But first, let me welcome back Ihor Perehinet, our Regional Emergency Director.
Thank you, Christiana. I'm really inspired by talking to Hans, of course, getting all these important messages and framing our discussion, but also I'm inspired by the keynote speakers that we just had in our studio. In the next 10 minutes, I will propose to concentrate on three main points. Why health security is the critical juncture due to the increasing frequency and complexity of the emergency, including pandemics, zoonoses, food and vector-borne diseases. What health security is as a defining issue, essential to the population security, prosperity, resilience, tied to economic stability and growth. Health security as the catalyst for resilience. Working with the health system, public health services must be integrated for the health security approach. Let me focus on the biggest megatrends shaping our future. And these megatrends is actually the health emergencies themselves. we are witnessing more severe outbreaks, including emerging pathogens like mpox and H5N1. Climate-related hazards are escalating, from the earthquake in Turkey to the flooding in Spain. Our region faces unprecedented conflicts, such as the war against Ukraine, the refugee crisis in Armenia, and the ongoing conflict in Israel and Palestine. On top of this, we are battling an overwhelming wave of false information that erodes trust in societies and the authorities. And the numbers do not lie. As we speak, we've lost 7 million lives to the biggest pandemic in our lifetime. Over the last decade, we have faced twice as many acute health emergencies, twice as many. And most concerning of all, people, especially most vulnerable, are marginalized, are losing confidence in our ability to protect them. Projections offer little comfort, but more people in our region could face zoonosis-driven pandemic, mosquito-borne infections, increased flooding risk. The European region, once considered prepared and preparedness region, just 5 years ago is now full of response mode and response to emergencies. Yet, these challenges offer opportunity. Member states in the European region made health security a priority at the 74th Regional Committee for Europe. This is the critical window for political and financial commitment that we must not miss. European Programme for Work 2 fully captures this momentum by placing health security at its core. It adopts a comprehensive approach that goes beyond the acute outbreaks to include climate-related hazards, conflict, epidemic and pandemic-prone diseases, and other cross-border risks that vulnerabilities and threaten to societies. I invite you to reflect on this proposed definition as you discuss in your breakout rooms the scope of health security and the key priorities to strengthen in our region. As such, EPW positions health security not just as a health issue, but as the prerequisite of sustainable development, economic and political stability, and social cohesion. That is why it must be embedded into national health security agenda and coordinated across the sectors. A resilient health system can handle any crisis and grow stronger, leading to healthy population and more stable and equitable future. Once again, I invite you to consider key actions that will help position health security as a top priority in government's agendas and ensure that implementation through a whole of the government and whole of the society approach. We are not starting from the scratch. In fact, in the health security chapter of the European Programme of Work, we are building on the existing progresses. Adopted by the Regional Committee, Preparedness to Zero strategy and the action plan already brings key elements that define health security as the high-level political agenda, encompassing all hazards, one health dual-track approach, working across the whole of the government and whole of the society, addressing interconnected risks and vulnerabilities, and building resilient system. What we are aiming to do here is to link health security with other EPW2 priorities, taking stock of preparedness to zero and other strategies for disease control and elimination, emphasizing the interconnectedness of the existing and emerging megatrends. This will reinforce health security as the central pillar of national security agendas and the regional vision. In particular, we are looking at the critical risks and vulnerabilities that undermine health security in the region. I mentioned fragile health services facing climate threats, chemical radionuclear hazards, emerging zoonotic diseases like mpox and H5N1, and vector-borne diseases. Critical challenges also include weak surveillance and laboratory capacities, the erosion of treatment options due to AMR, and declining vaccination coverage leading to outbreaks like measles. Persistent threats such as MDR-TB, HIV, and hepatitis remains, while political instability, rising non-communicable diseases, and aging population further worsen the situation. This highlights the need for paradigm shift, moving to a broader concept of the health security grounded on the principles outlined in the Preparedness to Zero. The figure speaks for themselves. Below the target vaccination coverage, the projected devastating impact of AMR, the persistent epidemics and compounding acute health challenges in the region, safeguarding health security demands tackling the challenges of old and new threats in the increasingly complex environment. This requires an integrated approach that links human, animal and environment health through all hazards, one health and dual track model. Preparing for a dual-track approach is the key building resilience in the European region. This involves strengthening health systems to address immediate crisis needs, while ensuring the continuity of essential services, including for NCDs, communicable diseases, and mental health. This involves checking the safety of the health facilities, ensuring they can keep running, and setting up emergency procedures. It also means quickly providing necessary medicines and products by increasing production and stockpiling. Alongside with the dual-track model, other critical approaches to resilience building is placing communities at the center. Embedded into Preparedness 2.0, this approach emphasizes communities as active partners with all authorities to build trust, strengthen response, and enhance resilience. We are moving from merely listening to the communities to co-creating interventions that resonate with the needs and perception. A key focus is tackling infodemics, where the mix of accurate and false information erodes trust and weakens public health responses. In conclusion, Europe stands at the critical crossroad for health security, with both rising risks and acknowledgement of its effect on security and prosperity. Yet, despite the lasting impact of COVID-19 and initial large-scale investment, funding for the health and emergency preparedness has rapidly declined, and political attention is waning. Today, we must unite, sustain momentum, and prioritize interventions that strengthen health security in the European region, making it the driver of health investment and societal resilience. WHO remains a key partner in this effort. Thank you all for your attention. Thank you for the participation, and I'm looking forward to your attending our breakout rooms, and we're looking forward to work with you. Thank you, Cristiano. Back to you.
Thank you, Ihor, for making such a solid case for health security as a catalyst for system resilience. This is the paradigmatic shift we need to work towards, one that addresses broad risks and vulnerability, as you clearly explained. And now to you, Rob. Rob, you oversee our work on communicable diseases, from vaccination, antimicrobial resistance, and even addressing the old epidemics like HIV, tuberculosis, hepatitis. So why, in today's age, you believe that infectious diseases remain a significant concern in the European region?
Good question. I think it's really important that you said in today's age, because these are really challenging times. This is a challenging age. Science is being questioned. An insignificant amount of focus is put on challenging those that oppose science. Yeah. We're seeing a challenge of not just science, but of scientists, and of course questions raised around WHO and the value of WHO. What I find interesting here is that those in support of WHO, those making the case for WHO, have one predominant narrative, and it relates to cross-border health threats and health security. And here, I think it's no surprise to us that these cases have been made positively in our defence, because of course a Minister of Health, a Secretary General of Health, Director General fully understands that when they receive that call at 3 a.m. in the morning from a colleague, it is going to be around a natural disaster, possibly a climate-induced disaster, or it is going to be of communicable or infectious nature, something that is unknown to us in terms of its transmissibility, where we're unsure of the severity of this threat. And it's no surprise that this agenda item is very important for all health authorities. Right now, as our previous speakers have said, we were in the epidemic at the epicenter of the pandemic. We sat at the epicenter of large periods of the Mpox outbreak. We are seeing currently 4 member states within the EU with circulating vaccine-derived poliovirus. 90,000 cases of pertussis last year, and 9 member states reporting deaths of a vaccine-preventable disease, and as Ihor's just very eloquently said as well, 60,000 cases of measles. This basically tells us one thing: the job is not done in this region in terms of infectious diseases. We need to remain vigilant, and we need to assure that our surveillance is sensitive, our laboratories are strong, that our ability to detect, well, first prepare, but detect and then respond to any emerging health threat is available to us at any time.
Thank you, Rob. So you're saying that it goes beyond the emergencies and outbreak. doesn't it? And what about the older communicable diseases that continue to linger?
Yeah, there are persistent, if you like, lingering older diseases. I mean, here I would, if somebody had told me 30 years ago when I was working in Cambodia on HIV prevention, that we would be seeing an increased epidemic on HIV, as again, Ihor has mentioned in his presentation, in the year 2025 in Europe, I would have laughed at them 30 years ago. Honestly, that would have been a preposterous notion, because we have all the technology at our disposal. Pre-exposure prophylaxis. We have antiretrovirals that drop the viral load to a level that is not just undetectable, but is untransmissible. We have widespread condom use and availability, and of course, a whole host of other technologies at our disposal to tackle HIV. But the problem is discrimination. The problem is stigmatization. The problem is a human one, not a technological one, where we're still seeing 50,000 plus new cases a year, and late diagnosis. Over 50% of cases are diagnosed late, and they have been for the last 10 years. So we have the persistent, we have the emerging threats, vector-borne diseases, arboviruses, those viruses and threats that are carried by ticks or by vectors, which of course are a result of a changing climate and a changing epidemiological pattern, of course, as a result of that in the region. And then we have the future threats. I mean, 125,000 deaths of antimicrobial resistance in our region currently, with a projected hundreds of thousands more and quite literally trillions of millions of euros cost by 2050, that future threat is very evident. And that's why this hearing is so important today. That's why the focus on communicable infectious disease elements of health security are very imperative right now in Europe.
Thank you. Thank you, Rob, for highlighting the interconnectedness of the risk and vulnerability to health security. And thank you very much, Ihor. This leads us to the next video, a short testimony from Spain that illustrates these linkages and how distant threats can quickly become challenges in our own communities. Watch closely.
Creo que el trato que se ha hecho a la gente que tiene el monkeypox ha sido bastante estigmatizante, ¿no? Me vi aquí una marquita, que ahí vi que dije, uy, ¿esto qué es? Y fui al hospital. Nadie me dijo que tenía nada.
Hay médicos de atención primaria que no conocen el mpox. Mientras nadie habla, es desconocido y lo desconocido da miedo.
Yo cuando me diagnosticaron VIH me daba mucho miedo decírselo a todo el mundo, pero sí que es cierto que echaba mucho de menos ver a alguien como yo o alguien parecido a mí que hablara sobre el tema sin miedo y sin tabús. Esto es lo que hacemos nosotros aquí, no solo yo, sino que mucha gente también, dar la cara, creo que es algo que nos empodera mucho y ayuda mucho a mucha gente también. Los médicos tendrían que ser un poco más abiertos en lo que viene siendo en mente, ¿no? No solamente en el tema del monkeypox, me pasa muchas veces con el tema del VIH.
Another powerful video that sets the stage for our panel discussion, highlighting three elements: confronting new threats, the vital role of community engagement, and to moderate the discussion and the panel. My name is Gunter Weiler. I'm coordinating the EPW2 process and had the pleasure to help open the series of 5 hearings in January. And I must say it has been wonderful to see that up to 1,000 participants joined us in each of the hearings. I've also been... So I confess today's topic is particularly close to my heart. Before we move into the panel discussion, I'd like to invite you to open our PIRA tool that many of you know by now and share with us what you think are the main priorities to strengthen health security in the European region over the next 5 years and how WHO can lead the way. You can access the tool using the QR code that you see on the screen or the link in the chat and provide up to 3 answers. The tool will be open for the rest of the day and you can go back anytime and modify your submitted answers or add new thoughts. Hearing directly from you is very important to us, and please rest assured that your input will directly contribute to shaping the health security agenda for the next 5 years.
Thank you, Gundel. So we now have an outstanding panel that brings together the diverse perspectives and key stakeholders needed to strengthen our preparedness for future health threats. To begin, let's unpack the concept of health security by exploring two fundamental principles that define it: a whole of society and a whole of government approach. I'm especially pleased to turn to Birgit Bishop-Ebbesen, Regional Director at the International Federation of Red Cross and Red Crescent Societies, given their strong role in grassroots community engagement. Please, Mrs. Bishop-Ebbesen. What is a community-centered approach to emergency management, and why is prioritizing local engagement essential for building resilience?
Hello, and really good to be here. I just want to check that you can hear me. Is the sound working?
Yes, it's perfectly fine.
Okay, thank you.
Great.
Okay, because that's the only thing we didn't check. To your question, thank you very much. And I think we all agreeing that we are living in uncertain times and we're having like rapidly growing humanitarian needs. We also see that politicization of traditionally humanitarian matters and the multilateral systems and the governments are unable to respond effectively to the emergent needs or to find the necessary political solutions. And that is where the local communities will play an even more critical role in addressing risks and vulnerabilities and increase societal resilience. I've just come back from a visit to Ukraine, where the Ukraine Red Cross colleagues and volunteers in Sumy, which is right at the borderline, I saw how they were part of their own communities and how they play such an important role at the center of the effective emergency response. It's really important to understand that they are not passive recipients of aid, but during very tough times, they are constantly identifying the risk, they're preparing for the crisis, and they are leading evacuations, offering first aid, psychosocial support, and a lot of other things. And that's why I think that the Preparedness 2.1 framework that we're discussing today really presents a forward-looking approach to health security. And that's one that I want to say is fully aligning with IFRC's commitment to a community-driven resilience. Health emergencies today do not occur in isolation. They are shaped by an interconnected web of crises, if you want. There is climate change, there's displacement, there is economic instability and persistent health inequities. And to understand that entanglement, we have started in the Europe region to use the lens of polycrisis, where all these different parallel crises that we see feed each other and amplifies the impact. And we are investing right now in research and approaches to try to tackle that phenomena. And I'll be very happy, maybe offline, to share more about that, but just to put it on the table. Addressing this kind of challenge requires a very strong local engagement and, for sure, a whole of society approach. Trust in public health institutions has unfortunately been weakened in many places. And that's where IFRC and the national societies, I see them acting as a bridge between communities and health authorities, ensuring that interventions are accessible, that they're inclusive, and also culturally appropriate. Combating misinformation and restoring trust are as critical as delivering health services themselves. That's something that we see very often on the ground. And I think that that's particularly important at a time where social media is a main source of information and where people risk being intentionally subjected to harmful information. So IFRC's strength lies in its network of national societies, their volunteers that are embedded with the communities, and they are there before, after emergencies. And health security starts at community level. Strengthening local health systems, supporting epidemic preparedness, and integrating risk communication into emergency planning are essential in ensuring communities can withstand future crises. So I think that's my answer to your first question. Thank you.
Thank you so much. And if you could add, what does it mean for how we should prepare for health emergencies, but particularly how can WHO and IFRC work more effectively together to strengthen these efforts?
Yeah, so thank you. I mean, I think we have already established a really good working relationship, but I also think that it can be stronger. And as IFRC, we really welcome the WHO Europe's leadership on preparedness 2.0, because we see that that's offering a structured but also a strategic approach to strengthening health security in a time, as I said, of very complex and interlinked crisis. We cannot help it but referring back to COVID-19 pandemic, which really exposed the vulnerabilities in global and national health systems. And for me, it also underscored the importance of localized, community-driven responses. That's what we need. And I think that IFRC, together with WHO in Europe, has to build on these lessons to ensure that health emergency preparedness is embedded within the community. So bringing it from the policy level into practice. And coordination between humanitarian and public health actors is critical. Emergencies, whether that's disease outbreaks, as we just saw in the video, or climate-related disasters or conflicts, all of this require a comprehensive and multi-sector response that integrates health, but also social and economic support. And that's where we will be good together. The opportunity for WHO and IFRC is to continue to bridge public health and humanitarian action. Next week, I'll visit Turkmenistan, Red Crescent. They are a very active health actor, and their IFRC's ability to support the network, combined with the technical expertise of WHO, I think can really ensure that policies translate into real-world impact. So I'm looking forward to those discussions next week. And health systems are overall under increasing pressure. So therefore, scaling up a robust, a data-driven decision-making, risk communication and community engagement are essential to ensure or maybe to reinstall public trust in health measures. And I think IFRC and the national societies are ready to work with WHO in Europe and the member states to ensure that equitable, inclusive health interventions that resonate with the communities we serve, that's what we are seeing as a path. And I will say, especially in today's environment, we urge a stronger alignment of funding mechanisms and flexible emergency financing to ensure that frontline responders can act early and that they can scale up rapidly. Health security must be built from the ground and up. We must move from reactive crisis management to a more proactive resilience building, ensuring that every community is prepared, that is protected, that is empowered and funded. A whole of society where different actors work closely together is needed. Thank you.
Thank you, Ms. Bischoff-Everson. You made a really important point that communities are not just recipients of services, but active participants in co-designing the response, and that this really builds trust. The idea of working together applies not only to how communities and health authorities work together, but also how different sectors work in a whole of government approach. To explore intersectoral collaboration a bit further, let me now turn to our next panelist. Dr. Taha Alexanderson, you are Director of Emergency Preparedness and Civil Defense at the National Board of Health and Welfare in Sweden, a country that has developed the concept of total defense. This concept focuses on defending society against a whole range of threats, not just military threats as the name defense might suggest. Could you explain what you mean by total defense and how it fosters collaboration across different sectors, with health playing a central role.
Absolutely. Thank you very much for the question and the opportunity to engage in this very important discussion, of course. I'm happy you brought it up, because let me just start by emphasizing that the Swedish total defense concept is one of the most crucial pillars of our preparedness and resilience. So regardless if it's a health crisis at peacetime or the very worst scenario, a war scenario. So the concept of total defense is really to show how we're coordinating our efforts, both military efforts, but also the civilian defense efforts, to protect Sweden in times of war and in heightened alert. And it's a very, as you mentioned, it's a whole of a society approach. It entails that the civil defense activities are carried out by many different actors and in collaboration with the military defense. So the word collaboration is crucial here, both within the sectors, between the sectors, but also with the military. We have three principles in the Swedish system that the preparedness planning is based on. These three basic principles: the principle of responsibility, of similarity, and proximity. And in accordance with these principles, all regional and municipal stakeholders and authorities, they have the primary responsibility for their preparedness planning within their jurisdiction. So this is a decentralized responsibility, and we believe, and the Swedish system is thinks that this decentralized responsibility ensures a multi-layered approach to this preparedness. Also here, there's a well-established civilian and military collaboration and understanding, not only about the need of collaboration, but also the interdependencies that we have within the healthcare sector, not the least in the event of an armed conflict. Just briefly, let me also emphasize the concept of this cross-sectoral planning, because in Sweden we have the civil preparedness system is divided into 10 preparedness sectors. Each has an assigned agency responsible for the sectorial coordination. So acknowledging this and acknowledging these cross-sectoral interdependencies is vital in, we believe, in fostering both a cohesive but also coordinated national approach to this preparedness planning.
Thank you. This is really interesting. So if I understand right, total defense is a concept that brings together many different sectors for protecting our populations from multiple hazards. What are then the specific implications for how the health sector can contribute and prepare itself for crisis?
So just identifying a single most crucial factor is challenging, but because obviously multiple and interdependent elements contribute to this, to having an effective response. But to answer your question, I think the points that I made in the previous, answering your previous question, looking at both the civil-military collaboration, looking at the multi-layered preparedness approach, but also having an effective cross-sectoral coordination is important. But if I'm to shed light on one new aspect, I think it's important because none of us have big stocks, and we're all facing different issues when it comes to healthcare workers. I think in the healthcare context, it's the ability to safeguard and enhance our surge capacity is one of the prioritized areas of work. So a key priority when discussing healthcare preparedness should be that we ensure that our healthcare systems are designed for this ability to scale up our capacities and to do this in a proactive approach. And this is not rocket science. This is knowledge within the healthcare sectors for decades, but just building on the 4 S's, looking at your staff and the personnel, and having a resilient healthcare workforce is, of course, fundamental. If we're to ensure having a medical support in times of crisis, we need to have efforts that mitigate our workforce strategies and of course work with both the recruitment but not the least with retention strategies. Looking at the second S and looking at facilities, unfortunately, key lessons learned from recent conflicts is that we need to have robust healthcare infrastructure, not only in times of flooding, but also in times of armed conflict. We need to have develop robust hospital facilities, and if they fail, we need to have the ability to provide healthcare in sheltered areas. Looking at our stuff, again, we all know this through the COVID pandemic, having stable supplies of essential medical resources, safeguard and open and free trade routes so that we can reinforce our supply chains is, of course, crucial for these factors. And finally, I think having this hearing and having these discussions and having jointly both representatives from the EU, from the WHO, we had ICRC and all these governments showing how the importance of this strong governance is essential to ensure that the healthcare systems, that they function smoothly, both nationally, but also in alignment with our international frameworks.
Thank you very much, Dr. Alexandersson. We explored the total defense concept from the health sector's perspective. And now we turn to a sector which is critical for effective all-hazard emergency management. It's my real pleasure to introduce Dr. Raed Arafat, Secretary of State in Romania. Dr. Arafat, as Head of Department for Emergency Situation in the Ministry of Internal Affairs, you advocate for a strong intersectoral collaboration, including with health. From your perspective, could you explain the importance of emergency coordination and highlight the new threats we should be better prepared for?
Of course. First of all, thank you very much for the invitation. And I will go just through the example we had during the pandemic. The Department for Emergency Situations is a structure under the Ministry of Interior since 2014, which brings under one umbrella emergency health response, that is pre-hospital emergency care, emergency departments mainly, but also all other structures from civil protection, like the fire service, like rescue services, air rescue, and so on. During the pandemic, we succeeded to do a national integrated coordination by having our national center activated, having within the center representatives of the Ministry of Health, Public Health Institute, local governments, and so on. And in each county, we had a miniature of that center also at the level of a county, having 40 counties in Romania. So the management of the situations was much more efficient, especially when unforeseen emergencies needed immediate response, including from the logistical point of view. That coordination permitted us to react much better. For example, when during the pandemic and our fourth wave, some hospitals didn't have oxygen, and the company which delivered the oxygen, the stockers, the liquid oxygen, they didn't want to deliver in the weekend, we had a hospital which was nearly going to go out of oxygen completely. So we had to activate the fire service in another county. We had to transport oxygen bottles to them. And we arrived to do all this involving police, fire, and everyone from one coordination center, so that we arrived before they had before the oxygen was depleted. This is a very small example. What we have seen is that integrated response, especially when strong entities like the Ministry of Internal Affairs, the fire service, which is a national service in Romania, also the support we got from the Ministry of Defense, gave a strong logistical support to the Ministry of Health. We could do things that the Ministry of Health alone would have never been able to do, and including transport of protective materials in the first weeks of the pandemic, using military airplanes to bring things from South Korea, and so on. So this showed us that when you bring the whole government together, you have a much better coordination, and you need to have an entity which takes the overall coordination. And in our situation, according to the law, this is the Emergency Situations Department. Now, we've seen this in another emergency when we had the large number of refugees coming from Ukraine because of the Russian aggression on Ukraine. And we've seen that when we had a whole of society approach, from the individual on the borders in the villages which wanted to help, to the local authorities, to the national authorities, cross-sectoral cooperation, Ministry of Interior, Ministry of Health, Ministry of Defense, this brought a much better response than if we would have been separate. So in my opinion, the integration is extremely important to manage correctly and fastly any emergency which may challenge us. The other issue on the threats, we have a lot of threats that can cause huge emergencies and huge number of casualties, whether we talk about the classical ones like major incidents, accidents, major exposure like a pandemic. We still need to think that today it's much easier than years ago to manipulate microorganisms, to create new microorganisms, and with the low price, with the low cost, even by terrorist organizations, and we may find ourselves facing a threat that we will not understand it and we will not know about it in a short time, which means we need to be very well prepared in responding, and we need to have the capacity to respond. There is something I say always, that the next disease after the COVID-19 is the acute post-disaster amnesia syndrome. And this is a real disease, which we see it especially in some of our entities, which do not recognize the need to prepare, which do not recognize the need to do things beforehand and to invest, because it's not lost expenditure. It's like an insurance that we pay every year for a vehicle, and we are very happy if we have no accident, but the next year we pay again the insurance. So this means that preparedness is much safer than being not prepared for an incident or for an emergency. We look that our hospitals are not prepared. We face every day a large number of intensive care patients staying in the emergency departments because of lack of place for them. So if you are lacking place for daily work, how are we going to face a disaster where we will need more space in intensive care and more care in the hospitals? So yes, integration is extremely important, and preparing for the worst case scenario and the unforeseen is very important. In Romania, I mean, it's not a secret, we had some opinions by our Court of Auditors against the preparedness and the stockpiling, and we took them to the court, and we won 2 cases at the highest level of court in Romania, at the Supreme Court of Romania, which cancelled their reports and their recommendations, based on the fact that preparedness is a must. It is not something that anyone can tell us that it is not needed or that it is an unjustified expenditure.
Thank you, Dr. Arafat. Preparedness is a must. And you mentioned the power of collaboration, particularly towards emerging risks that can jeopardize our health security. Are there other technological threats, such as cyber attacks, that we should address through strong coordination across the critical sectors? That's the second question to you, Dr. Arafat.
Thank you very much. Cyber attacks are one of the issues we need to be prepared for. And Romania was also, some hospitals suffered from cyber attacks, whether for ransom or whether just to create a perturbance in the system. But we need to think that the emerging artificial intelligence, AI, can be used on the positive side of things, but can be used on the negative side of things. I was talking about the modified microorganisms, and AI may be of support to those who want to harm, not only to those who want to do good. So this is one aspect that we need to think of, that it might create threats to the health sector. Other technologies that may be helpful or may be against us are regarding communications, of course, cyber attacks, new technologies we apply in the emergency, like telemedicine, which is extremely useful, and we need to have it legalized in every country for all levels. In Romania, we have it very clear for the emergency response. Our ambulances are equipped, the ambulances with EMTs, with paramedics, they are all equipped with telemedicine possibility, thousands of transmissions a year. And this can be very useful in case of major situations. So technologies that will be of help to us are emerging. Some of them are there since a long time, but are not being used, and we need to use them more, like the telemedicine capabilities.
Thank you, Dr. Arafat, particularly for highlighting the range of emerging health threats that we are facing, and of course the need for strong collaboration across a whole range of sectors to prepare for them and to respond. We've heard now a lot about new threats, ones that we haven't encountered before. But there are also long-standing challenges that may resurface as security risks. Earlier, Rob touched upon HIV, TB and antimicrobial resistance, but this also applies to diseases on the verge of eradication, like polio. While the European region was declared polio-free in 2002, there are challenges that remain. We are privileged to have with us Professor David Salisbury, who is the chair of the Global and European Regional Polio Certification Commissions. Professor Salisbury, given recent developments, should we still be concerned about polio? And does polio represent a threat to our societies?
As chair of the global and indeed the European regional certification commissions, nothing would give me more pleasure than to make myself redundant and to be able to declare that polio has indeed been eradicated and we no longer need to worry about polio. And on the very positive side, we have certified the eradication of wild poliovirus type 2 and wild poliovirus type 3, and those are fantastic achievements. But we still have wild poliovirus type 1, which is circulating extensively at the moment in Pakistan and indeed also in Afghanistan. And if it circulates anywhere in a country, it can circulate anywhere in the world. So the wild poliovirus is still a threat. It can indeed be exported, and it can come into any of our countries, and it poses a significant threat wherever we've got communities with low vaccine coverage. So the threat remains, it cannot be ignored, and it can be minimized by high population immunity and high quality surveillance, which we have in many countries, but not everywhere in every country, and therefore those remain priorities. Add to that, we also have vaccine-derived polioviruses, particularly emerging from parts of West Africa and Central Africa. Although these are vaccine-derived viruses, they can spread, they can be transmitted, and they can paralyze, and so they can behave just like wild polioviruses. And we've seen those viruses being imported into our countries in Europe, and we detect them, we detect their transmission, and we've been lucky so far that we have not had problems of paralyzed people as a consequence of vaccine-derived viruses. But we cannot and we must not ignore those threats. So polio is, it's an example of what any infectious disease threatens us with. We know how extensive those threats can be beyond just the disease themselves. Antimicrobial resistance is a really good example. The macroeconomic impact of pandemics, again, another example from the threat of ignoring traditional infectious diseases. There's one other element of polio that I would just want to remind everybody about, and that is the importance of containment of polioviruses. In the European region, we have more laboratories holding wild polioviruses than anywhere else. More laboratories have got wild viruses in Europe than anywhere else. And the threat is always going to be there that those viruses can leak inadvertently and then spread. And so we must not just look at the threats from outside our region, we must also consider very carefully the threats within our region, and laboratory containment is one that we should never ignore. Thank you.
Thank you, Professor Salisbury. And you said polio is an example for many of the other infectious diseases that have been partially long and around with us for a very long time. And thank you also for outlining why those are actually representing still a threat for us today. Now, based on this, what solutions do you think we should prioritize to address the threat from polio and other infectious diseases to health security?
Polio is an example, but it works for all of the others. We have to have solid population immunity, and that means the whole population without communities who either have no access to vaccines or who may reject vaccination. So we must ensure that we have the highest possible vaccine coverage and then the highest possible population immunity. The next step in our defense, and it I think applies to all communicable diseases, is surveillance. We cannot relax our surveillance. And indeed, interestingly, we are seeing more feedback from environmental surveillance, especially for polio, than we had used in the past. So the second element has to be surveillance, and you have to invest in surveillance. And then the third element is rapid response. And we have to have preparation for rapid response for any of our communicable diseases. And with those three pillars in place, we will be better defended.
Thank you, Professor Salisbury. You made very good insights on the polio situation, but we now move from polio to conflicts, to other health hazards, where health system must prepare for the next emergency with a dual-track approach, one that addresses immediate crisis needs while ensuring the continuity of essential services for chronic conditions. In this, the civil society has a critical role. Dr. Tetiana Deshko is the Director of International Programs at the Alliance for Public Health in Ukraine, and she has been working on the front lines throughout the war. Dr. Deshko, not all people are equally affected in emergency situations. Based on your experience, what are the most vulnerable in emergencies like conflict, and how can we ensure that they are not left behind?
Thank you. Thank you very much for having me and for this very important conversation. Those who are vulnerable in ordinary times, they become times more effective in the times of conflict. If you are taking a regular medication like HIV medication or opiate agonist therapy or taking pre-exposure prophylaxis, disruptions in supply put you at increased risk. Not to mention the lack of health-seeking behavior for key groups. You're actually working on saving your life in the first place. The additional layers of vulnerability are related to several of the following factors. Living unoccupied and close to frontline area. Unfortunately, times and again, opiate agonist therapy patients in Ukraine on the occupied territories were cut from the life-saving daily medication they were receiving in Ukraine. And unfortunately, many of them died. Migration and displacement. In the first months of war in Ukraine, 30,000 out of 130,000 HIV patients receiving ARVs were lost to follow-up. They arrived in new locations without knowing the language, the health system, and where to go. They needed to be navigated, to be linked again to the necessary treatments. People with disabilities as a result of war are a new risk group. Veterans and civilians with amputations require health and social care. WHO office in Ukraine supported a very important project recently for those who completely lost their sight during war. Coordinated effort and funding is critical. Health and humanitarian clusters were there to coordinate, and WHO played a very important role. It was so important that donors stepped in, and civil society based in Ukraine actually became the backbone of critical health and humanitarian response.
Thank you. And civil society organizations are crucial in supporting the most vulnerable. In Ukraine, they have ensured continued access to health services and essential for displaced populations. What are the key lessons that we can learn from this experience?
Indeed, ensuring access to healthcare for groups in very, very different and actually polarized situations was critical. And I would like to share 4 very practical lessons from our experience. Firstly, for those living close to frontline, where there is effectively no health infrastructure or doctors left, ensuring healthcare was very important. And mobile vans-based primary healthcare became a working mechanism. Starting December 2022, our fleet of mobile clinics has been serving annually about 10,000 people in 200 villages in 6 frontline territories. And they were doing HIV, TB, STI testing and linking to treatment, EKG, blood pressure, sugar, oxygen management, ultrasound, now dentistry. This should continue as a service providing modality for poorly populated areas after the war is over as well. Secondly, long-acting treatments were very important to serve people on the move. Pilot of long-acting depot buprenorphine for 300 people, also with support of WHO, those who are living with opioid dependence. Pre-exposure prophylaxis with long-acting cabotegravir for 100 men having sex with men, which started during this time in Ukraine, is a critical learning to actually continue to help reduce burden on healthcare system and people when they're very stretched. Thirdly, digital tools were key to keep contact with people on the move. We launched telemedicine, which has exponential coverage now. It helped to keep the contact with patients who moved to new locations. In the first 18 months of war, we established a service help now, online, offline patient navigation. It was providing hundreds of consultations per day to link patients to treatment in their new locations. We are now mailing commodities for harm reduction. We are mailing HIV tests that are being ordered online with hundreds of deliveries per day. We launched artificial intelligence powered digital assistant who is able to consult 24/7 when you are in the bomb shelter or out of working hours. These are the things that should continue, and they are saving costs and time. Mental health must be addressed. Among drug-resistant TB patients who we surveyed, 34% had depression and required psychiatric treatment. In the latest studies, which are still ongoing, we are learning that 1 in 2 men in Ukraine who are also preparing to be conscripted, they are not seeking any health services, not to mention HIV services. Internally displaced women have suicidal thoughts, which they are not seeking to address. These lessons are not only critical to our ongoing response at war, they have helped us keep epidemics under control, but they already are helping build a stronger, resilient, cost-effective and efficient healthcare after the conflict. Thank you for your question.
Thank you, and what an impressive testimony of the role, the important role of civil society. We've now heard about multiple direct threats to health and security, some old and resurging, some new and growing. But one of the biggest threats to the health of our populations is of indirect nature, the spread of mis- or disinformation. Today we even speak of infodemics, which can be as deadly as viral epidemics themselves. This is now such an important issue that the Lancet has established a dedicated working group. And we have with us today from the Lancet Ms. Xian Crucifix, who is co-chair of the Lancet Counter Misinformation Working Group. Ms. Crucifix, can you share with us your assessment of how big an issue infodemics, including false information, are today?
Thanks, Gundo. I will start by saying false information is, of course, not a new phenomenon, but we cannot ignore the fact that today's information environments enable the spread of information, including false information, like never before, which can lead to infodemics. Now, there has been debate as to perceived versus actual prevalence of mis and disinformation. Measurement is tricky, but we do know an infodemic impacted lives during the COVID-19 pandemic, and today well-worn falsehoods are circulating and devastating. Anti-vaccine mis and disinformation have played a role in recent measles outbreaks, for example. As discussed by Hans, Ihor, and my fellow panelists, the world is facing several interconnected challenges. Opposition to evidence-based policies and positive behaviors because of false information masquerading as truth puts health security at risk. We should be cognizant and curious about the drivers of false health information and trust in authorities. Factors associated with mis and disinformation include a sense of powerlessness and political extremism. Then there are commercial influences. Equally, structural inequities must be addressed. Individuals' offline realities matter. The Lancet has stressed mis and disinformation represent a societal threat. And given the potential for harm, it is critical we come together on this issue.
Thank you. It's really important and impressive to see how direct the health effect of false information or disinformation can be. Now, considering this, what key steps can and should countries take to counter mis and disinformation and build public trust in science and health authorities?
There is no one approach, and I would encourage countries to develop partnerships and cross-party strategies that center communities. However, for broad recommendations, number one, invest in infodemic management. Infodemic management, IM, provides insights into communities' questions and concerns, as well as false information. It also supports evidence-based interventions like pre-bunking, and the Lancet has adopted IM elements, fostering a shared language with collaborators, more strategic resource allocation, and improved communications. Secondly, advocate for information empowerment. It is near impossible to meaningfully engage with the content presented to us daily, help strengthen societal resilience to health mis and disinformation by advancing media and health literacy. Demand better from tech platforms. False, harmful information will never empower us. The public, civil society, and governments should collectively push for higher standards. And finally, be very visible in your support for well-done science. Reiterate its importance and benefits. Do processes need improving? Yes. Should institutions better explain the nature of scientific inquiry, uncertainty, and consensus? Absolutely. But people are seeing headlines about cuts and framing that undermine. We have to do more to connect science to people's everyday lives and values, and that includes through our actions, not just rhetoric. Thank you.
Thank you, Xian's Crucifix. This is clearly an issue that we want and need to give much prominence in the next European program of work. And definitely it's an issue very close to my heart. This brings us to the end of the panel. Many thanks to all our esteemed panelists. It was super interesting to hear your perspectives And I'm sure they triggered a lot of thoughts and reactions with those following online. And now is the time where we want to switch gears and engage with all of you directly in our breakout sessions, which are really at the core of this hearing. There are a number of breakout sessions from you to choose from, and it wasn't easy to make up a set of them that truly reflects all the dimensions of the conversation we had. But we have selected 7 themes that we hope capture the many aspects at play, and we invite you to join the group that is most appealing to you. After the breakouts, we will not return to the plenary, but rest assured, we will be capturing the discussion. And don't forget to use our Para tool through the QR code or the link that continue to share your thoughts. Your input truly make a difference. Before we start the breakout, let's take a few minutes to enjoy a healthy break. Stretch your leg, grab a glass of water. We'll be waiting for you at 11:45 sharp. And when you are ready for the breakout, leave this meeting, choose your room, give us your best for the next 60 minutes because your insight matters. Thank you.
Today also concludes our series of 5 public hearings. And I think it is fair to say that this is the most comprehensive consultation we have ever organized in WHO Europe, thanks to your presence throughout. And we really appreciate your commitment and ideas. Your input will be the basis for developing what we call the Health Compass in EPW2, which will sketch out our collective health agenda for the region in the 5 years to come. And that will ultimately go to our member states for adoption at the next regional committee meeting. For this, a huge thank you from all of us in Copenhagen, and wishing you insightful and engaging discussions after the break.